Good morning. I'm going to go ahead and get started. Welcome to the library today, and welcome those of you also who are watching online. This morning we are delighted to welcome Rain Bowie back as part of the What the Health series. Rain is going to talk to us about organizing our medical history by using a body resume to ensure that we have accurate health information to share with medical providers. This type of record can save time and stress by simplifying our medical appointments. Rain, thanks so much for being here today.
Thanks so much, Renee. First of all, I just want to say thanks for being here. I'm really happy to share this information that has definitely made a big impact for me. First, I just want to ask how many of you here today find doctor visits to be stressful? Yeah. Is there anything particular about it that's stressful for you?
It never was until I got cancer, and then of course it always felt stressful going to the doctor.
Oh, wow.
After many years, it's not quite so bad.
Oh, well, I'm sorry to hear that, and I'm glad you're here today with us. It sounds like you went through a long road, and you're very strong to get here. So thanks again for joining. I do think you're in the right place to get some help with any future experiences that you might have. I do want to say, yes, my name is Rain, and today I am going to be sharing the best idea you probably haven't heard of yet. This is called the Body Resume. This document is not only customizable, but it can save you tons of time, reduce your stress, and it can even help doctors provide better care by giving them a clearer picture of your health. So by the end of this presentation, you'll see how the Body Resume can make your healthcare experience more efficient, less overwhelming, and much more manageable, no matter what the health issues are that you deal with. So we will go over what exactly a body resume is, walk through examples of what you can include on your own, and then we will wrap up with a Q&A towards the end, so be sure to save any questions you might have for around then. So first I want to take you through my own medical frustrations, which led me to the discovery of this and to be here today. I grew up with a wide variety of health problems. I grew up with unpredictable complications, rotating prescriptions. I was constantly seeing new doctors near and far. And I also even had to move a bit, which made managing my medical information very overwhelming and stressful. So every time I saw a new doctor, it was constant catch up with all of my past history, everything I've been through, which makes an already stressful experience even more draining. So by end of 2021, I found myself recently moved to Arkansas due to COVID-related hardships, but also with new medical complications in a new place where I didn't really know anyone and have a history with doctors. So I found myself right in the middle of the same storm that I was familiar with, but without any family support. So new specialists, new problems, but the same frustrating process. I was basically spending a lot of extra time in doctors, time I would never get back, and it basically made taking care of my health a full-time job on top of a full-time job I already had. So I was just very frustrated one day, and I kind of threw my hands in the air, and I was like, why can't I just send them, like a job, a resume of everything I've been through, so that way I don't have to tell all these doctors over and over again. And so it kind of dawned on me, maybe I really could do that. Maybe I could have a resume that I can just send. So I immediately went on a web search, and it took me a little while to finally land on the term body resume. Otherwise, you're going to get education on how to get a job. Not exactly what I wanted, but even though there wasn't a whole lot of information out there already, it was still just enough for me to get started, and that's exactly what I did. I customized my very own version, and literally everything changed. I found myself filling out far less paperwork, I had a faster understanding with my doctors to get my needs met. I seemed to be taken more seriously by medical staff, and just in general, I had smoother appointments and far less stress than I had experienced in the past. So by mid-2023, I had achieved all of my major health goals and tackled all of these major problems, some of these things that I had struggled with for my entire life, over 30 years, and I was able to achieve all of this in just 2 years. Some of this stuff I was even told I might not be able to ever fix, but here I am today with the best health of my life, and the body resume I do truly feel was key in that success in getting here. So whether you have a complicated medical history like mine or not, I truly believe anyone can benefit no matter what your health situation is. There is a phrase that goes, "Health is a crown only the sick can see," which is a phrase that we often take for granted our health until it's gone. And unfortunately, being sick, being in an accident or something else can strike us at any time, whether we're prepared or not. And so because of that, I am truly confident that this tool can transform your life, just like it helped transform mine. So put simply, what a body resume is, it's a document with your medical information which is designed to be shared with healthcare professionals. Think of it much like a job resume, but it is for your health instead of any work experience. So it breaks down all of your medical information into easy to read categories with quickly to see important details. So the best part is that it's completely customizable. You can control the level of detail, and because of that, there is no right or wrong way to make one. It works for anyone, no matter what your situation or history is. So let me explain why this is helpful. First of all, it is very easy to update. Whether you've got new medications, updated test results, seeing a new doctor, you can just modify that document in minutes. It also relieves a lot of pressure, so no more having to remember every single detail. Say you have an emergency appointment, or like me, an early appointment, and you don't like getting up early. So instead of having to recall all of your medical history on the spot, you can just have everything there right on at your fingertips. So we've all at some point been there struggling to remember specifics, whether life's too hectic or something else is going on. But by having the body resume handy, all that stress virtually disappears. However, it's not just about convenience. For those of us who have physical challenges, such as arthritis or vision or speech issues, this actually helps remove that need to have to repeatedly fill out forms or to tell someone over and over again what you have been through or done. So this can help you manage your medical care, as well as anyone else who might be assisting you with what you're taking care of. You can also lastly think about it this way. Health is much like a puzzle. Doctors are trying to take all the information that they have, their education, the things that we have given them, and they're trying to piece together your unique situation, figure out how to make it work. By providing a clear, organized outline, then doctors can get closer to having a full picture of your health. It can also ensure that nothing is missed and that you have everything right there on the table. Now, the body resume is especially helpful for, say, going to an initial medical intake, seeing a new doctor, or even just a routine checkup. But it's not limited to just going to see your doctor. It can also be used with other trusted professionals, such as a dietitian, personal trainer, or perhaps even a dentist to help them get a comprehensive view of your needs. It is very adaptable, which is part of what makes it so very powerful. Personally, I think pretty much everyone and anyone could benefit from this. whether you have trouble remembering your health history, like me, just dislike handwriting, or have issues with it, or if you just want more efficiency in your medical appointments. But it is particularly useful if you do see multiple doctors or specialists, or if you do have an extensive or complicated history. However, even if you have a simple medical history, it can still save you time and lots of stress. So there are also more benefits than first meets the eye as well. One of the first things that I noticed was that it was easier for doctors and staff to read and interpret my information. I had always tried to keep my handwriting very simple and easy to read. However, it turns out that still no one interprets that the same way. So by having the typed information, they were able to quickly assess what I had and put it into their system. So it ultimately saved the intake staff some time and saved me time to get to my doctor. I also noticed I could include far more detail with certain specifics that I had that some of those cramped intake forms could not give. Sometimes there was only half a line or a line or two. No blank page to fill things in. So this makes sure nothing important is missed out. So, especially nothing as arbitrary as just not having enough room on the paper to tell them about it. One thing that was a bit unexpected in my experience was that medical staff did seem to take me more seriously. I would bring in this document to them, and it, of course, streamlined their process and made it easier for them. I often received compliments or praise. A few times they even told me that they wished other patients brought in at least something like that. So by providing the body resume, it does send a very strong message to your medical providers that you're basically saying, hey, I care, I'm organized, and I'm actively involved in my health. So I had always had typically good interactions with doctors and medical staff, but even with that, I still felt an extra level of support and even respect by providing this. And most surprisingly was literally how much time it saved. It saved tons of time. I figured it would help a little bit, at least with filling out forms or having to recall everything, but there were times when an expected appointment of, say, an hour was cut by half or more just by having this, an initial doctor's visit, mind you, as well. So while I did expect it to help with certain things, I was just really blown away by how much time, again, a resource we never get back once it's spent, was saved with it. A big portion of that is why I wanted to provide this today. So basically, a lot of that time happens because you fill out your intake form, and then you give it to the staff after however long that takes. Usually they might have some opening questions to clarify some things, maybe your handwriting, maybe just make sure they get certain things incorrectly, and then they compile everything together from their system, and then they get it ready for the doctor to see. So then you see your doctor, and oftentimes there's still more questions and more things and details to be covered, and then you can get to the heart of your issues or goals. And depending on what those goals are, maybe the doctor has to order tests or get follow-up paperwork from another doctor, or who knows what else might happen, and there's still usually some back and forth before you can finally leave. And again, that's not even counting any follow-up appointments or referrals you might have. So by having the body resume, I often came into appointments with all my doctors very prepped, ready to dive straight into whatever my goals were, often referencing the body resume itself over their own documents because it was they really appreciated it. And so a lot of those back and forth steps were shortened, if not skipped entirely. So again, when I was expected at times to have an hour-long appointment, I'm getting out in like 20 or 30 minutes. So, it was very eye-opening to have that experience. It just really affirmed that I wished I had known about this sooner. So now that we have covered some key details and benefits, we can start diving into how to actually create our own body resume. So we'll go over some key categories and details with specific examples that you could provide or add on your own. I do want to say only add what you're comfortable with. You can customize multiple versions if you would like, such as a general body resume for all doctors, or perhaps something with more details that you only want to share with a certain doctor. Now, as you're getting started, there are a few considerations to make. First of all, you'll need a computer and printer. The computer for creating and editing your documents. If this is something you don't have, then there's always a public library, such as here at the Fayetteville Public Library, that can help you access those materials you might need, as well as printers. But if you just need a printer, there are also other outlets, such as Office Depot or Max or even Walgreens. If you simply just need to print the document, that can help you with that as well. Also, be sure to ask yourself who is going to be looking at it. By asking yourself this, it can help you understand what details to actually include. Again, are you going to have a basic template for all of your doctors, or are you going to have something a little bit more specific for a specific doctor? So just by keeping that in mind can help you understand, again, what all you want to include. Also, be mindful of readability. Using an easy-to-read sans serif font such as Arial, Calibri, or even Comic Sans is acceptable. Make sure that it is about a point size of 10 to 14. That is the ideal size for most people to be able to read comfortably. Also, be mindful of keeping it safe. Keep it secure, of course, but also don't add any sensitive information that could pose risks. For example, so you want to have a copy on hand, either in your purse or on your car, in case something happens. Maybe you're not able to interact with the staff. Having something on hand to make sure you still get the utmost care. You are going to want to limit that to the health essentials, which is no social security number, don't include a home address, and no specific details about your job information. So again, it is good to have a hard copy, but just be mindful about those things if you do have that and where you're going to keep it. So it is easiest to start building and get started with your basic details. This is stuff that every intake form is going to ask you, which is your name. Be sure to include preferred and legal if they are different. Include your sex. You can also include your gender identity and pronouns if you want. Your date of birth, as well as contact information such as a phone number or email. This is also a good place to put any disabilities or accommodations that you might need. Keep it very much at the forefront so that way staff and doctors can be mindful of that whenever interacting with you in your appointments. And this is also a good place to add your emergency contacts. So like how we're keeping our information safe and we don't want any of that to get out, it is also good to limit information about them. So again, keep that to something like a phone or email. Don't include their social security number or their home address. So they're especially being so kind to help us out when we need it. This is also a great place to include your goals or objectives, especially if you have any. Whether you're trying to get off a certain medication or perhaps you're trying to achieve a certain health goal, this is very helpful to get doctors and staff to line up with your goals so that way they can give you relevant information or they can at least prioritize items and suggestions alongside you. So this very much helped me as far as helping them determine and outline exactly what I wanted to get done. So beyond that, we're going to build a little bit more with some of these details, which is your current medical information, which is your current or most recent doctors. So be sure to include the name, how to contact them, what they treated, and the period in which you saw them. So this can help new staff receive or get medical documents or perhaps referrals or experiences that you had if needed. So that can also save a lot of time. Also be sure to include your medications or supplements, including any over-the-counter medications you might be taking. So list the names, dosages, how long you have or were on them, or perhaps even why you stopped. This can help doctors spot potential interactions or know what kind of new meds to suggest to you, especially if maybe a recommendation they wanted to give was something that didn't work for you. This is also a great place to include your immunization or vaccine information. This can help doctors see any vulnerabilities that you might have, especially if something that you might want to prevent. I say this because some vaccines can wear off much sooner for different people. So this is a very good thing to track. One good example that I have is I have a friend who works in plumbing, gets a lot of potential exposure to tetanus. However, this person learned that they actually have to get the vaccine about every 5 years. So something like that could be very, very important depending on what you're trying to prevent your exposure to or that you want to be safeguarded against. So things like blood work can determine your antibodies as well. So all of that can work together as part of a piece of the puzzle to help keep you safe. Now we're going to get a little bit more colorful, more details for a more detailed picture of what we have experienced in our medical history. So this is a good place to include either very recent or definitely most impactful experiences. Things like your recent screenings, especially if anything was abnormal or new, such as your test work or test results, or even copies of your blood work. I will say I got copies of my blood work one time at an initial annual review, and then I took it to a specialist, and because I had it within a certain amount of time, it actually saved me a few $100s or more of not having to get another blood draw, because a lot of the markers they were looking for was within the time range they needed. And so not only did it save me from having to get poked so many extra times and have to get more screenings, but it also saved me money with my insurance from not having to do extra rounds of what I already needed or had to do. So it can help prevent duplicate tests or save time in ways that, again, were unexpected, like how that was unexpected for me. You can also include major illnesses, anything from childhood on, which can include, say, chickenpox, a long run of bronchitis, or perhaps even a very rough round or multiple exposures to COVID. So this can be very important to note, especially as research continues to connect health risks over time as we age or more information comes out due to research. For example, such as the connection of shingles and those who had exposure to chickenpox as a child. This is also great to add your allergies, whether it's just simply seasonal, pets, latex, food, or anything else that you might have a risk or exposure to. This can help avoid any adverse reactions with perhaps medications you're taking, or even to see any interactions you might have potentially currently. Also prevents them from exposing you directly in the setting, like I said, either with exposure in the doctor's office or with a prescription. You can also add your mental health here, conditions that you might have been diagnosed with or perhaps even suspect within yourself, for example, anxiety or depression. This can also be a good place to include any current therapies you might be taking. So always good to add that near the top as well. So now we're going to go over to our day-to-day habits, and I will say honesty is very crucial if you add these specifics. This will be like your safety procedures, such as the use of seatbelts or helmets on a bicycle or motorbike, gun use or ownership, or exposures to different hazards, either in the home or work, such as exposure to gas. This can also be where you can list if you consider or use smoke detectors or carbon monoxide detectors, again, either at home or at work. Your lifestyle, from your diet, exercise, smoking and drinking habits, and even your sexuality and relationship status can all give a lot of insight into potential risk factors that you might have. I will say I know someone who had very high cholesterol and battled it for years. You may not know much about cholesterol, but I will say being in the 800s is not good. However, this person constantly going back and forth with doctors, spent a lot of time and resources, tried different medications, and nothing was really working until this person finally relented and gave details more about their lifestyle. Yes, this person did work in a very active career field. However, this person also got a severe lack of cardio and vegetables. They did prefer to, say, get burgers and pizza and things like that. So whenever this person finally relented and talked to his doctor about what was going on, made some minor adjustments, and then because of that, he was able to figure out with his doctor that it wasn't entirely diet and exercise that affected him, but more of a genetic component, which was very difficult for him to find because he was adopted and did not have access to that information. So while in this situation that was only a small part of it, it was still a big factor ultimately in figuring out something part of the bigger picture. So this is why honesty can be very important. It can be very key. Again, only include on your document what you are actually comfortable with. But I will say I think our habits impact our health in small and big ways. So I think the first step to ultimate improvement is just being able to be truthful. So then we can move into more specifics of procedures that we've been through. Things like surgeries, anything from biopsies to brain surgery can be included here, especially if you went under anesthesia. This is a good time to also indicate any complications or perhaps delayed healing or other reactions you might have had with these surgeries. Also include accidents, car accidents, big or small, broken bones, sports injuries, again, big or small. Even what seems like a minor impact on us one day is still something that can have long-term side effects for us. Be sure to include dates of whenever these happened. It is okay to make approximations. Now, going into even more specifics, we have a family health history that you can include. Try to collect information from your immediate family as best as you can, particularly parents or even grandparents. Be sure to note any major health issues from them, such as illnesses, diagnoses, mental health, or allergies. You can also include information of other close family members as well, such as siblings, half-siblings, aunts, and uncles. So having this information provided on your document can help doctors assess genetic risk factors for certain illnesses. But you can also mention if you were adopted, if this information is inaccessible or just otherwise hard to talk about, so that way doctors can know how to work with you in that situation. Now we do have some other specifics, battle of the sexes, if you will. While we do have a general experience that is shared amongst us all, we do have things that are very specific to us depending on our sex that is very important to our health and also is good to talk about and make note of. So for those born female, your menstruation history, such as your age of first menstruation and regularity of your cycles, is good to add here. As well as including your pregnancy experience, including miscarriages, successful births, or complications or experiences that you had along the way. It's also a good place to include any birth control or hormone replacement therapies you've experienced, so be sure to specify methods of use, durations that you had it, and perhaps reasons for starting or stopping it. You can also add your general gynecological health issues, exams, results, relevant surgeries, or any major changes or experiences that you have. While males share a different experience, they still have important things to take care of, like sharing the results of a PSA or prostate-specific antigen, tests or details of prostate exams, especially after the age of 50. This is also a good place where you can just add general relative health history, such as pain, exams, surgeries, or significant changes. So while the body resume is extremely powerful, it is not the entire battle. We do need effective communication with our healthcare professionals on all levels. So I do just want to let you all know that you do have the power to request your medical records, whether it's just a note that the doctor is making for a general appointment, to updated test results, copies, or reasons for starting or stopping meds or not getting a test. This is something that you can get copies of, you are entitled to, and you can keep your own copies for references, which again can prevent repeating tests or delays on getting results, like my example of providing my copies of blood work. This is also something where honesty matters. I would strongly encourage to only include truthfulness in your document. I would say including nothing is better than including the wrong or misleading information, which again makes honesty very crucial even in your consultation, like with my friend and their cholesterol. Also, try to remember that doctors themselves are also human. They can have long days, stress, get sick, and they're not perfect. They are doing their best to help us, but at the end of the day, they're still not mind readers. Just good to keep that in mind. And also be sure to remember that honest and clear communication combined with the body resume ensures the most success. So I do realize this sounds or might sound like a lot, but you really don't have to do it all at once. You can start with your basic details and basic medical details and just build it from there. And once you do have it all built, then it is easy to update. You can share with any doctor anytime. You can also keep a copy on your phone or make sure to have a hard copy in an easy to access spot. I will say it reduces a lot of stress whenever you can have it handy. So now that we've gone over what a body resume is, why it's useful, and how to get started, does anyone have any questions? I would like to open the floor if there are any curiosities that you have. Yes?
I think it's a really good idea. I have boxes and boxes of medical records that I just really like to throw out. And so I think if I could just consolidate everything into a resume, it'd be great. It would be very beneficial for me when I have to fill out forms. But I'm wondering about how receptive staff in doctors' offices are to you giving them a resume, because it seems like the trend more and more is before I go to a doctor appointment, they want me to go online, fill out their form. So having the resume would help me fill out the form, but they want that done before I even get into the office. And then when I get into the office, I find a lot of times they want to repeat it, and you get tired of doing it over and over again, and it sounds like it would be so simple to just hand them a resume. But I kind of have this feeling that they're still going to want me to get on their iPad and check the boxes and do it the way they have it in their system. So I'm just wondering if you've had any experience with that.
Yes, I have actually. So I started bringing in the body resume, and even though there would be times, they wanted me to fill out the online portal profile or what have you, I would run into an issue of something's not working or I forgot. So I would bring it in, and oftentimes when I brought it in, the staff would literally just fill it out themselves. What they had broken down to me is that essentially they take that information that we put in for whatever reason, and then they still convert it, or they got to put it into a different face of the system that we don't entirely see. Not every single one of them, but enough of them for me to have seen a pattern. That does seem to be rising more and more post-COVID. Though they were very accommodating to me, I had already done all of this. Again, they just kind of took my document and went to work on it, and they didn't force me to fill it out online. They didn't force me to fill out a digital thing, aside from perhaps some signatures that might be needed in actual dates, which that's kind of a thing that they do need in general. But beyond that, I just kind of started skipping things, and I'm technically capable of doing all that, but it just was easier for them to take it. As far as anyone who might not be receptive to that, I think that's just going to be on an individual basis. We do have some people who are newly hired and they're still learning the job, they're just trying to do everything right, and then there are other people who knows what communications between their staff and how that works and runs. So this kind of can help take a lot of that back and forth. It's just like, here's my thing, take what you need. At least in my experience. So.
I find I'm sorry. If they have you in the system and it's kind of a follow-up or repeat visit, that you do normally they'll hand you the tablet and say, check if there's any changes, but you still have to go through the whole thing and read the whole thing to check if you have any changes. So it's still kind of repeating what you've done already.
I was just asking, what point do you actually give them, or who? Because you have to check in at the desk very first, and fill out the papers, and then there's usually a nurse who runs you up and takes you back and talks to you before the doctor comes in. Do you give it to the person that checks you in at the very start, or do you give it to the nurse who meets with you before the doctor, or do you send it in after you first get the call that you got the appointment, or like when do you give them the resume, and to who usually along the line?
Yeah, so I was bringing it in at first, not a whole lot of information. I was just kind of asking, I was like, who do I turn in this form to? And they were like, oh, you'll just give it to me. And then I'd be like, but I have this handy resume. And sometimes they would just take it and they'd be like, oh, this is everything we need. We just need your signature and date. And yeah, so instead of having to fill out all of this information, I think only once or twice there was something I hadn't included that they specifically needed. So in that case, I did fill that out, but that was far less to remember than all the medications that I'm on or ever was on, or the hip surgeries that I had or ever had. So it still took off a lot of the load. Best thing to do is to just, I would say, ask who you need to give it to and what is legally required for you to fill out for your appointment that day, besides what they might need for updates or recommendations.
Is it always hard copy, or can you have it like on your phone and just send it to them? Because sometimes they're...
Yeah, you can have a copy on your phone or say like Google Drive. I will say, after having worked in certain security fields, email is not technically the most secure. While it can be secured directly to them, I do just want to say be mindful of it. It would be, of course, much safer to give it to them in person or to fax it. But depending on the relationship that you have with your doctor, you very well can email a copy. I just want to stress the potential security risk, just because that can't be 100% secure, like say a fax or handing it yourself. But having a copy on hand, especially say, like I gave an example for if you want to have an emergency copy for, say you, for whatever reason, are rendered unconscious, but you have it in your purse or on your phone, as long as it's in an accessible spot, that's the main thing. So you could always keep your emergency copy, say, as a screenshot on your phone. There are many different ways you could probably create or come up with it, but like I said, it's a digital copy, best as a hard copy, I would say, because that way if you have a hard copy you can destroy it if you need to, but the digital copy you can update as needed. So I think it really just depends on your individual needs. It's very flexible, it's very customizable, so whatever you might need and whatever your doctors or staff have available that they can work with. Sometimes they've been okay with me emailing it. Sometimes I've just uploaded it into the portal, much like a job resume. Sometimes, yeah, there is that frustration of, hey, I've uploaded my resume. Why do I have to fill out all these details again? But unfortunately, that's perhaps maybe with making this more popular can help as well. So.
And is it becoming more common for offices, like the doctor's office, to see these things so they don't look at you like, what?
Well, yeah, so I first...
becoming more common?
Well, when I first brought it in, I was pretty self-conscious because I was like, look at me, that nerd. But all of the staff are very, very helpful and kind. I remember my first time I was like, I bet this is a weird day for you, someone bringing this in. The lady was like, oh, no, we love it when people do this. One of the times, and they were like, wish more people would. She said it might be technically a little bit uncommon, or it's not super common, but she said it's not uncommon as well, at least for her experience. So I think it's just becoming more and more acceptable. I mean, I know for me, I've tried to interpret different handwritings just for sign-up lists, and this is like people's phone number and email. This isn't even important information, so I have learned firsthand that interpreting handwriting can take a lot of time assessing, because we can read our own handwriting much better. So I think just by having that, it is a relief to them, especially like, hey, I've already covered the bases, I know what I'm doing. But they were always very kind about it, very supportive. So hopefully it becomes more common, I would say. But I mean, like I said, whenever I looked online just a couple years ago, there's like two web pages about it that has much of any detail, and they essentially mirror each other. So again, it wasn't a whole lot at first, not a whole lot of knowing, but I think there's just, just trying to get the word out there. So hopefully with presentations, like this and people talking about it, making it more common, hopefully it just gets easier for everyone. So, do we have any more questions? Right. Well, thank you everyone for all the great questions and your participation. I really appreciate it. Before we leave today, I just want to leave you with one final thought, and that is our time and our health are our most valuable resources. Once we've spent them or once they're gone, which is what makes them so very valuable. No one wants to spend their time overwhelmed at a doctor's appointment or struggling with their medical history. So the Body Resume really helps you take control to save time and also get the most out of every visit. So I do strongly encourage to build your own Body Resume. It can make a big difference in your health journey. You do deserve a system that works for you, not the other way around. I do also want to say, please stay in touch if you use the Body Resume in the future, or if it does change your life, have any questions. I would love to hear about it or help you. I'm also going to be making a template at my website, rainbowie.com/body-resumes. So that will be coming soon to help everyone who might need a little jump in getting started. But otherwise, I do want to say thanks again for coming, and I wish you all the very best in your health. So.
Awesome, thank you very much.